The next plyometric we're going to do is called a squat jump. For this jump, we're going to have the athlete get shoulder width apart. She's going to reach down and touch the turf, keeping that good alignment, and jump up, reaching for the ceiling, landing with good alignment. So she's landing in that knee flex position, toe to heel landing. Once again, we're looking for flexion angles greater than 60 degrees. That's the beauty of this jump. It really engages the hamstrings. And that is the squat jump. You're going to repeat that for the desired time, and it will progress throughout the phases. The next jump we're going to do in phase 3 of the jump program is called jump up, down, vertical jump. It's the only depth jump we do in the entire jump program. So what Katie's going to do, she's going to get into her start and end position. That flex knee position, she's going to jump up onto a 16 to 18 inch step, immediately jump off, touch the turf, and explode into a vertical jump, landing in that flexed knee position. She should be transitioning through this fairly quickly, decreasing the amortization phase on both the step and on the turf. And that is jump up, down, vertical jump. One of the most difficult jumps we do throughout the whole program is called a tuck jump. This is a difficult jump to do in that it requires an enormous amount of strength, balance, and proprioception. Form is key on this. We need to really watch this. So for this jump, we're going to have her get down in a squat. She's going to jump, bringing her legs up as high as possible, landing toe to heel, soft landings. At any point during this exercise, if you see faulty movement patterns, we have the athlete stop. So that is a tuck jump. We just want to make sure athletes maintain good form throughout that jump and make sure that we see good joint mechanics. This next jump is called the scissor or rudder jump. This is one of the more difficult jumps in the first phase. For this jump, we're going to ask the patient to get into a split leg squat position. She's going to jump up, switch her legs. The object of this jump is keeping the chest over the knee. The front leg should hit the ground before the back leg, and we want to try to keep the back leg as straight as possible. This really overloads that front leg. You're getting maximal co-contraction of the quadricep and hamstring during this exercise. As she progresses, we ask her to get more height with each jump. And that is the split leg squat or rudder jump. In the last phase of the jump program, we're going to move from bounding for distance into jump bounding for distance. For this exercise, she's going to get in her broad jump position. She's going to jump forward. She's going to land on one leg and then go into bounding for distance. She landed on her right leg. We're going to keep track of that. She's going to go back. She's going to do 4 jumps, landing on the right leg first, and we're going to do 4 jumps, landing on the left leg. So 4 runs on each leg, and that is jump into lateral bounding for distance. The next jump we're going to do is called richochets. There's 2 types of richochets. We're going to do front to back and side to side. With richochets front to back, we're going to have her get in the ready position. She's going to jump over a barrier here, and then back, landing toe to heel. So it's heel to toe on the front, toe to heel on the back. Soft landings. We're looking for about 18 inches or about shoulder width as far as how much excursion between the feet here. We usually don't start with the barriers, and we kind of add that in as the patient progresses. So this is richochets bilateral, front to back. For the next one, we're going to have her turn sideways, and we're going to do this same exercise, jumping side to side. We also call these mogul jumps. So she's going to get in the ready position. She's going to jump up and over, toe to heel, loading and unloading that knee. So once again, we're trying to decrease the amortization phase, or when the feet are on the ground, using that eccentric muscle strength to rebound and come right back into the next jump. And that is richochets bilateral, side to side. Okay, the next jump we're going to do is richochets unilateral, front to back. So we did bilateral in the first phase. We're moving into unilateral, which was really good at helping athletes develop confidence in their surgical leg. So we're going to get into the same start position as we would in bilateral, but we're going to take that into one leg, and she's going to jump forward and backwards in the same manner, landing softly on the link. This requires an enormous amount of balance on the leg and technique to maintain good alignment of the knee. Good. And then we would switch over to the next foot. Then from there, we're going to move into unilateral ricochets side to side. So same thing, keeping good alignment. We really want to watch that valgus knee moment. We want to make sure she keeps good alignment. And we're going to go up and over the cone and then back. If patients are having a hard time with this one, a lot of times what I'll have them do is put their back leg down kind of like a tripod, touching the toe. That helps kind of balance them a little bit. If they're having a hard time maintaining their good form, that's a good way for them to practice. So that is unilateral ricochets side to side. The last jump of the jump program is called hop, 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 stick. So it's 3 single leg hops in a row, sticking and holding that last jump. So she's landing with that flex knee position. She's going to walk back and switch her legs up. Once again, decreasing the amortization phase with each hop and making sure she keeps good form throughout the exercise.